Welcome to Gene Clips. My name is Andy, and I am a genetic counselor at Children's National Hospital. Today, I'll be talking about non-invasive prenatal screening. Non-invasive prenatal screening, or NIPS, is a genetic test to assess the risk of certain genetic conditions in a fetus during pregnancy. Unlike invasive procedures such as amniocentesis or chorionic villus sampling, which carry a small risk of miscarriage, NIPS involves a simple blood draw from the pregnant person. This testing can occur as early as 10 weeks into a pregnancy. In the past, NIPS was typically offered to pregnant individuals at increased risk of having a baby with a chromosomal difference, such as those of advanced maternal age or who have had a previous pregnancy affected by a genetic condition. However, current guidelines recommend offering NIPS to all pregnant individuals. NIPS analyzes small pieces of DNA that circulate in the pregnant person's bloodstream. These DNA pieces, coming from both parental and placental cells, provide valuable genetic information about the fetus. By analyzing the relative amounts of fetal and parental DNA, NIPS can estimate the risk of certain genetic conditions in the fetus. Typically, NIPS screens for three well-known chromosomal conditions: trisomy 13, trisomy 18, and trisomy 21, also known as Down syndrome. Most NIPS screens also look for extra or missing copies of the X and Y chromosomes, which are known as the sex chromosomes. For this reason, your doctor may describe NIPS as a blood test that identifies your baby's sex. NIPS may include screening for additional chromosomal disorders that are caused by missing or extra sections of a chromosome. Furthermore, NIPS is beginning to be used to test for genetic disorders that are caused by changes in single genes. It is important to remember that NIPS is a screening test, which means it does not give a definitive answer about whether or not a fetus has a genetic condition. The test can only estimate whether the risk of having certain conditions is increased or decreased. Also, because this test looks at DNA from both the pregnant person and the fetus, there is a chance to detect a genetic difference in the pregnant person that was previously unknown. Rarely, NIPS shows a false positive or false negative result. If you receive a positive screening result, your doctor may recommend a diagnostic procedure during pregnancy, or testing of the baby's DNA after birth to confirm the result. Your prenatal care team can answer your questions about NIPS or refer you to a genetics clinic for more information. Thank you for watching Gene Clips.